Good afternoon.
Good afternoon, ma'am.
Good afternoon, Miss.
Good afternoon, ma'am.
Good afternoon. Good day, Shalana. കഴിച്ചോ ഓക്കെ നമുക്ക് സിക്സ്ത് മൊഡ്യൂളിലെ സെക്കൻഡ് ചാപ്റ്റർ ആണല്ലോ നമ്മൾ റിവിഷൻ പറഞ്ഞിരുന്നത്. ഓക്കെ, ജസ്റ്റ് ഒന്ന് വായിച്ചു നോക്കിക്കോളൂ കേട്ടോ. ആ ചാപ്റ്റർ ഒന്ന് ജസ്റ്റ് ഒന്ന് വായിച്ചു നോക്കാം, എന്നിട്ട് നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാം. 5 മിനിറ്റ് കഴിഞ്ഞിട്ട് നമുക്ക് റിവിഷൻ സ്റ്റാർട്ട് ചെയ്യാം കേട്ടോ. വായിച്ചു നോക്കാം. Okay, number start along mission. Okay. One is the primary focus of those who work in healthcare operations management. One is the primary focus of those who work in healthcare operations management. Option വായിക്കാം. Performing surgeries and clinical procedures, overseeing the health facility and staff functions, developing new medical technologies, conducting pharmaceutical research. Okay, option B ആണ് answer. Why is operations management particularly important and diverse in the healthcare industry? Why is operations management particularly important and diverse in the healthcare industry? Option A, because all healthcare facilities operates in the exact same way, because operations often require unique solutions based on the variety of factors, because healthcare has no legal or regularly requirements, because patient satisfaction is not a priority. And answer vara. Question. Why is operations management particularly important and diverse in the healthcare industry? Option, because all healthcare facilities operates in the exact same way, because operations often require unique solutions based on a variety of factors, because healthcare has no legal or regularly requirements. Okay, option B ആണ് answer. Next question. Proper operations management can help eliminate manual processes to serve what? Proper operations management can help eliminate manual processes to save what? Option, only time, only money, both time and money, office space. Okay, both the time and the money and answer. Option C ആണ്. Implementing proper tools for operations management can improve one among healthcare providers. Implementing proper tools for operations management can improve one among healthcare providers. Competition, effective collaboration, social event, salary disputes. Option B ആണ് answer വരുന്നത്. One of the key benefit of strong operations management is the reduction or elimination of one in the workflow. One of the key benefits of strong operations management is the reduction of elimination of what is the workflow. Staff managers, patient interactions, bottlenecks, successful outcomes. Okay, option C ആണ് answer. According to the text, what is a major concern area for the management team of any hospital? According to the text, what is a major concern area for the management team of any hospital? Option: the color of the hospital walls, efficient operations of the hospital, the cafeteria menu, the number of parking spaces. Option B ആണ് answer. Which of the following is not listed as an main operational challenges faced by hospitals? Which of the following is not listed as a main operational challenges faced by hospitals? Patient satisfaction, hospital security, patient safety, employee vacation schedules. അല്ലാത്തത് ഏതാ? ഓക്കെ, ഓപ്ഷൻ ഡി ആണ് വരുന്നത്. What is a key operational issue that need to be addressed regarding hospital facilities? What is a key operational issue that needs to be addressed regarding hospital facility? Maximization of bed management and usage, increasing the number of television in rooms, decorating the lobby annually, expanding the gift shop. ഏതാ വരാ? ഓപ്ഷൻ എ ആണ് ആൻസർ. Streamlining and optimizing the utilization of the operation theater is listed as a challenge related to what? Streamlining and optimizing the utilization of the operation theater is a listed as the challenges related to what? Patient entertainment, asset utilization, billing accuracy, staff training. ഏതാ വരാ? Patient entertainment, asset utilization, billing accuracy, staff training. Streamlining and optimizing the utilization of the operation theater is listed as a challenges related to what? Patient entertainment, asset utilization, billing accuracy, staff training. Option B ആണ് കേട്ടോ. ഓപ്ഷൻ ബി ആണ് ആൻസർ വരുന്നത് കേട്ടോ. 1 minute കേട്ടോ, ഞാനിപ്പോ വരാം. 1 minute. Okay, next question നോക്കാട്ടോ. The wait time for patients at various departments is a challenge that directly impacts what? The wait time for patients at various departments is a challenge that directly impacts what? Option: the hospital's profit margin, patient satisfaction, the hospital's security system, the energy consumption of the building. Hospital's profit margin, patient satisfaction, hospital's security system, energy consumption of the building. Option B ആണ് answer, patient satisfaction. The document lists medication error as a critical operational challenge related to what? The document lists medication error as a critical operational challenge related to what? Financial productivity, patient safety, hospital security, regulatory standards. Option B ആണ് patient safety ആണ് answer. What impact can diverse operational challenges have on a hospital? What impact can diverse operational challenges have on a hospital? Option: a positive impact on employee morale, a high impact on productivity, employee morale, and patient satisfaction. No impact on the hospital's performance, a minor impact on financial results only. Option B ആണ് ആൻസർ വരുന്നത്. The challenge of waste, fraud, and abuse of resources affects one aspect of hospital operations. The challenge of waste, fraud, and abuse of resources affects one aspect of hospital operations. The hospital's reputation only, the efficient use of scarce resources, the architectural design of the hospital, the hiring. Okay. Option B ആണ് answer. The main operational challenges are broadly categorized around issues like patient safety, hospital security, and what else? The main operational challenges are broadly categorized around issues like patient safety, hospital security, and what else? Option വായിക്കാം. Financial challenges and hospital productivity, marketing and advertising, cafeteria food quality, landscaping and groundscaping. എന്താ പറയാ? ഏതാ വരാ? Okay, financial challenges and hospital productivity ആണ് answer. Option A ആണ്. What is a primary benefit of Successful healthcare operations management. What is a primary benefit of successful healthcare operations management? Higher employee turnover, increase the operational cost, a better client experience, more complicated billing process. എന്താ പറയാ ഓപ്ഷൻ സി ആണ് ബെറ്റർ ക്ലയന്റ് എക്സ്പീരിയൻസ് ആണ് വരുന്നത്. More efficient operations lead to less wasted time and money, which translate to what? Better profit margins, lower patient satisfaction, more administrative work. ഏതാ ആൻസർ? ഓക്കെ, ഓപ്ഷൻ എ ആണ് ആൻസർ. Automatic recurring task like appointment reminders helps to free up staff time for what? Automatic recurring task like appointment reminders helps to free up staff time for what? Longer coffee breaks, tasks that are more important to the customer and the bottom line, more manual data entry, creating more complex work flow. Option B ആണ് ആൻസർ വരുന്നത്. How can clarifying roles for employees improve operations? How can clarifying roles for employees improve operations? It increases confusion and delays. It helps ensure tasks are not delayed and missed. It is a way to reduce the employees' salary. Okay, option C. Option B ആണ് answer. By collecting and reviewing patient satisfaction data, what can a healthcare organization do? By collecting and reviewing patient satisfaction data, what can a healthcare organization do? Option: ignore underperforming areas, take meaningful action in underperforming area, justify higher price for services. Okay, option B ആണ് answer. What is the first step suggested for improving healthcare operations management? What is the first step suggested for improving healthcare operations management? Hire more staff, collect and leverage data, reduce the number of services offered, implement a more manual process. Okay, option B ആണ് answer. The document states the manual processes are costly and time consuming. So, what is a must for operational efficiency? The document states that manual processes are costly and time consuming. So, what is a must for operational efficiency? Automation, more meetings, stricter employee schedules, less technology. Okay, option A ആണ് ആൻസർ വരുന്നത്. അടുത്തത്, what is described as the key to improved patient outcomes? What is described as the key to improved patient outcomes? Disjointed communication method, effective communication among caregivers, patients, and providers, less access to patient data, increased staff turnover. Okay, option B are the answer. Why are traditional communication method like phone calls and emails considered disjointed? Why are traditional communication methods like phone calls and emails considered disjointed? Option like they provide excellent real-time access to information. They don't provide the real-time access required to remain prepared. They are most secure a way to share patient data. They are preferred by all modern healthcare workers. Okay, option B and answer. To increase efficiency, the text suggests look for tools that do one with the principal system like payroll and HR. To increase efficiency, the test suggests looking for tools that do one with the principal system like payroll and HR. Replace them entirely, operate independently from them, integrate with them, make them more complex. Okay, option C ആണ് answer. An automated appointment reminder system is an example of improving operations by an automated appointment reminder system is an example of improving operations by clarifying roles, identifying patients' care trends, automating or simplifying recurring tasks, improving employee productivity. Okay, answer C ആണ് വരുന്നത്. Strong healthcare operations supported by centralized technology puts the focus where strong healthcare operations supported by centralized technology puts the focus where the administrative paperwork on caring for patients, on managing IT system, on reducing staff numbers. On administrative paperwork, on caring for patients, on managing IT system, on reducing staff numbers. Option A ആണോ? Option B ആണ് ട്ടോ answer. Caring for patients. Next question. What is the benefit of integrating systems and having accurate data across a tech stack? What is the benefit of integrating system and having accurate data across a tech stack? It creates data silos and increases errors. It makes the customer experience more complicated. It allows for the seamless customer and employee experience. It increases the time spent on manual data entry. Option C ആണ് answer. Correct answer ആണ് ട്ടോ. ഇനി next question. What should a healthcare organization do with the data it collects? What should a healthcare organization do with the data it collects? Store it without analysis. Use it to make informed, data-driven decisions. Share it publicly on social media. Delete it immediately to serve space. Option B ആണ് answer. What kind of tools should be provided to employees to improve operations? Up to outdated tools that are difficult to use. Outdated tools that are difficult to use. Tools that are not integrated with the other system. Tools that meet employees where they are and provide easy access to information. Manual tools like paper-based scheduling books. Option C ആണ് answer. Okay. The document suggested that to meet growing demands, it will be necessary to do what? The document suggests that to meet growing demands, it will be necessary to do what? Maintain the current system without a change. Reorder a current system of providing services. Focus only on building new hospitals. Reduce the number of healthcare providers. Okay, B ആണ് answer. What is a key point to be remembered about the healthcare system? What is the key point to be remembered about the healthcare system? New money alone will guarantee effectiveness. Healthcare is always delivered in a way convenient to the consumer. Health must remain high on the scale of social, political, and economical priorities. Manpower production for the industry is perfect as it is. Okay, option C ആണ് answer വരുന്നത്. The decision-making process in healthcare should empower whom more? The provider, the government, the consumer, the insurance companies. Okay, option C ആണ്. Raising overheads in healthcare are described as negatively impacting whom? Rising overhead is healthcare are described as negatively impacting whom? Only the patient, only the providers, or those who are a part of an ecosystem, only the insurance companies. Okay. C ആണ് ആൻസർ വരുന്നത്. നെക്സ്റ്റ് ക്വസ്റ്റ്യൻ പറയാം കേട്ടോ. Which of the following is not listed as a factor contributing to the rising cost of managed care? ഒന്നുകൂടി ഞാൻ വായിക്കാം. which of the following is not listed as a factor contributing to the rising cost of managed care? And again, population, the decreasing cost of medical technology, prescription drug prices, increasing cost of medical technology. Option B ആണ് വരുന്നത്. What is a proposal mentioned to help manage rising healthcare cost? What is a proposal mentioned to help manage rising healthcare cost? Option പറയാം. Adoption of electronic health records, focusing on more expensive complex treatments, reducing the emphasis on quality and efficiency, keeping patient records on paper. Option A ആണ് ആൻസർ വരുന്നത്. In 2008, what did medical care declare regarding avoidable medical errors? In 2008, 2008, what did Medicare declare regarding avoidable medical errors? It would provide extra payment to cover them. It would not come the treatment for the 8 avoidable medical errors. It would ignore the issue of medical errors. It would reward hospitals with the high cost of medical errors. Okay, option B ആണ് answer. The healthcare industry is a focusing structural change that require providers to organize around a new set of standards, including the healthcare industry is a facing structural change that require providers to organize around a new set of standards, including option വായിക്കാം, complexity, high cost and inefficiency, value, accountability, quality and efficiency. Okay, option B ആണ് answer. The challenge of maximization of bed management is a concern related to the challenge of maximization of bed management is a concern related to patient comfort, efficient use of hospital facility, staffing ratios, the hospital's marketing plan. Patient comfort, efficient use of a hospital facility, staffing ratio, the hospital's marketing plan. Answer വരാം. B ആണ് answer ട്ടോ. Efficient use of a hospital facility. 1 minute ട്ടോ. നെക്സ്റ്റ് നോക്കാം കേട്ടോ. A key benefits of clarifying employees' role is. A key benefits of clarifying employee role is option one. Increase the confusion, decrease the employee productivity, reduce the delay as everyone knows who is responsible for task, more time spent in meetings. Key benefit of a clarifying employees' role is increased confusion, decrease the employee productivity, reduce the delay as everyone knows who is responsible for tasks, more time spent in meetings. Option C ആണ് ആൻസർ വരുന്നത്. Leaving surgical tools inside a patient is an example of an. Leaving surgical tools inside a patient is an example of an administrative task, unavoidable medical complications, avoidable medical errors, effective surgical procedure. Administrative task, unavoidable medical complication, avoidable medical error, effective surgical procedure. Option C ആണ് ആൻസർ. Okay. Document suggests that healthcare is often delivered in a way that is convenient to the. The document suggests that healthcare is often delivered in a way that is convenient to the option consumer, provider, patient's family, insurance company. Answer consumer, provider, patient's family, insurance company. Option B ആണ് provider ആണ് ആൻസർ വരുന്നത്. ഇനി നോക്കിയേ. Regulatory standards and energy mandates fall under which category of hospital challenges? Regulatory standards and energy mandates fall under which category of hospital challenges? Patient related, financial related, operational, staff related. Patient related ആണോ, ഫിനാൻഷ്യൽ റിലേറ്റഡ് ആണോ, ഓപ്പറേഷണൽ ആണോ, സ്റ്റാഫ് റിലേറ്റഡ് ആണോ എന്നുള്ളത്. Regulatory standards and energy mandates. Okay, B ആണ് ആൻസർ. Fall under which category of a hospital challenge? Option C ആണ് കേട്ടോ. Option C ആണ് വരുന്നത്. The three components of healthcare operations management are administrative, financial, and dash. Three components of healthcare operations management are administrative, financial, and dash. Option വായിക്കാം. Surgical, marketing, legal, technical. Surgical, marketing, legal, technical. Option C ആണ് ആൻസർ. Operational challenges in a hospital are described as being of a fluctuating dash. Operational challenges in a hospital are described as being of a fluctuating dash, importance, intensity, cost, duration. Importance, intensity, cost, duration. Okay, B ആണ് answer. What is a potential negative consequences of disjointed communication in healthcare? What is a potential negative consequences of disjointed communication in healthcare? Increased patient satisfaction, details falling through the cracks, lower staff turnover, improved patient outcomes. Increased patient satisfaction, details falling through the cracks, lower staff turnover, improved patient outcomes. Okay, option B ആണ് answer. Okay, effective operations management is described as a. Effective operation management is described as a option one-time task, process requiring proper ongoing decision making, an important aspect of a healthcare, task only for the IT department. Effective operation management is described. Okay. And the option one-time task, process requiring proper ongoing decision making, an important aspect of a healthcare, task only for the IT department. Okay, option B ആണ് answer വരുന്നത്. Value-based reimbursement is a concept that falls under which component of operations management? Value-based reimbursement is a concept that falls under which component of operations management? Administrative, legal, clinical, financial. Value-based reimbursement. ഇതിലെന്താ വരാ? Administrative ആണോ, legal ആണോ, clinical ആണോ, financial ആണോ? Okay, financial ആണ് ട്ടോ. ഒരുവിധം നിങ്ങളപ്പോ ചാപ്റ്റർ വായിച്ച് പഠിച്ചിട്ടുണ്ടെന്ന് ഞാൻ വിശ്വസിക്കുന്നു. ഓക്കെ, ആൻസറുകൾ കൃത്യമായിട്ട് പറയുന്നുണ്ടായിരുന്നു. ഓക്കെ, അപ്പൊ ഇനി നെക്സ്റ്റ് ക്ലാസ്സിൽ വരുമ്പോ നെക്സ്റ്റ് ടോപ്പിക് നെക്സ്റ്റ് ചാപ്റ്റർ പഠിച്ചിട്ട് വരാം കേട്ടോ. 6th മൊഡ്യൂളില്. ഓക്കെ, അപ്പൊ നമുക്ക് നെക്സ്റ്റ് ക്ലാസ്സിൽ കാണാം. ഓക്കെ, താങ്ക് യു.
മിസ് ഏത് ചാപ്റ്റർ ആണ്?
6th മൊഡ്യൂളില് ഞാൻ എടുത്തിരിക്കുന്നത് സെക്കൻഡ് ചാപ്റ്റർ എടുത്തിട്ടുണ്ട്. പിന്നെ ഏതാണ് എടുത്തത്? ഇൻഫർമേഷൻ സിസ്റ്റം അല്ലെ? എടുത്തിരിക്കുന്ന 4th ചാപ്റ്റർ അല്ലേ? ചാപ്റ്റർ 4. അപ്പൊ അത് നെക്സ്റ്റ് ക്ലാസ്സിൽ കേട്ടോ. നെക്സ്റ്റ് സൺഡേ നമുക്ക് നോക്കാം, റിവൈസ് ചെയ്യാം. ഓക്കെ, താങ്ക് യു.
താങ്ക് യു മിസ്.